In the United States, pancreatic cancer is the fourth most common cause of death due to cancer. Early on, there are often no symptoms, and by the time of diagnosis, the cancer has usually spread to other parts of the body, and it's very lethal. But new clinical trials at a local cancer care center are giving some people hope for survival.
I was a very, very active person, and so when I got this diagnosed, I said, how can this be me?
But it was her. Last July, 74-year-old Sharon Sartorius from Plymouth was diagnosed with pancreatic cancer.
I played golf on Monday, and by Thursday I was in the hospital, and diagnosed with a disease that is life-threatening.
Roughly 35,000 Americans are diagnosed with pancreatic cancer each year, and the survival rate very low.
Pancreatic cancer is a great challenge. It's in fact one of the, if not the most challenging human cancer there is in terms of survival outlook.
Dr. Roderick Schwartz is the medical director at the Center for Cancer Care in Goshen. He says the survival rate is low because pancreatic cancer is often caught in advanced stages. As for the symptoms?
The development of jaundice, that's always abnormal and needs to be investigated. But if there are components such as back pain, if there's some unexplained weight loss, if there's some development of diabetes, so increased blood sugar levels in combination with back pain or weight loss, those would be very concerning constellations.
Now, most patients are treated with a standardized approach, including surgery, radiation, and chemotherapy. But there's also new protocols in experimental treatment.
At the Center for Cancer Care in Goshen, we have several protocols available for innovative, not proven, but very promising therapies.
Sharon's family helped her research where to go for help. They decided staying local was her best option.
They were able to give me some hope that there are things we can do. Because I think there's, in any disease, there comes a point when you have to trust somebody. And if you don't, it's all for naught.
Now, Sharon Sartorius had surgery and chemotherapy for her pancreatic cancer. She is now part of that clinical study, receiving vaccinations once a month for the rest of this year in hopes that her body will fight off any future cancer. And according to the American Cancer Society, there are no established guidelines for preventing pancreatic cancer, although cigarette smoking has been reported as responsible for 20 to 30% of those cases.